it's not about creating the barriers between the people in audiology and people that are deaf. It's about collaboratively working to make these environments better. And I think one of them, especially with COVID-19 and things like that, the masks, which is, I get it, the money, we need clear masks and things like that, but at the end of the day, like, there's so many other communication methods to use with the masks. I mean, one of the main ones that we all know is the calling of patients, which is it's so profound when you think about it. And coming into the waiting room and calling patients that are deaf, I mean, it's bizarre. But sometimes even there's some people that don't even pop their head, you just pop their head behind the door and just to call a patient. And I'm like, you need to be visible, you need to be seen. But there's so many ways of doing that if they've not got the money. I mean, you can hold a whiteboard up, or you can give someone numbers when they come in and then just put that number up, or just little things like that. Because at the end of the day, it knocks people's confidence when they can't hear, and especially with the masks as well. So that's one of the main ones. One of the other main ones that's been so obvious now when I've been sat in the waiting rooms is people ringing up. People ringing, and then the other day I heard a lady, a receptionist, shouting down the phone, and I thought, this person obviously can't hear. So do you know what I mean? And I just think there must be ways in creating technology. There must be a system of where people can access it online. I mean, there's things like EMIS and things like that people use. There must be like software that can be created so people can just log in, book an appointment, or even if that can't be done, then maybe at the forefront of receptionists is, how do you communicate in the future? Do you go by email? Do you go by phone? Because like before, now and before, I was by phone, and I can still do by phone, but other people can't. So I think that's a massive one. One of the most profound experiences that I've had, especially when I lost my hearing, was an audiologist that was just not really compassionate. I mean, it was the day that I was told that I'd lost all my hearing, and I mean, I can't even explain the emotions that was going through my mind, really. And she was it was just a really, really bizarre situation. She had a mask on. I was telling her that I couldn't hear, and she was just repeating herself behind the mask. And I was very, very upset that day. So you've got to take that into account. But I suggested communication methods to her, which when I look back on, I'm thinking, you're qualified in this profession. You're a trained professional. And she didn't have a pen, she didn't have a piece of paper in her office, and then her machine where she did the testing wasn't working. So I thought maybe you should have had that ready and tested before I'd come in. So I sat on my own for about 10 minutes. Yeah, it was just crazy. That kind of experience was probably one of my worst. Always do better with awareness, and it'll never be 100%, but just finding ways to make it a little bit better, especially for those who lack self-confidence and self-esteem. I think that's the most important thing, because once you start losing your hearing, you do become isolated unless you've got that support network around you. And the audiology is the environment where they should be the most aware, promoting awareness, where everyone else can learn, really. Yeah.